The UN then has warned that climate change is driving more intense and more frequent heat waves, which in turn generate pollutants, threatening the health of human beings and, of course, other living things. Well, the wildfire smoke recently suffocating cities from Athens to New York may be perhaps the most visible sign of air pollution brought on by heat waves. Extreme heat, though, can also induce a whole host of other chemical processes that are hazardous for human health equally. That announcement, as I say, coming via the United Nations World Meteorological Organization in its annual Air Quality and Climate Bulletin. We can talk more about this report. Chloe Brimicombe is a climate scientist at the University of Graz. She joins us. Chloe, thanks very much for speaking to France 24 this afternoon. The UN then sounding the alarm, saying that pollutants are more and more hazardous for human health. How so?
So, year on year, we've seen that air pollution is one of the leading cause of deaths globally for people, and this is across all age groups. So, during heat waves, for example, we've been more used to over 65s dying, but air pollution affects all of us. And this is also true for those babies that are in the womb and then being born, all the way through to those that are elderly. Some of the pollutants we've seen are sulfur dioxide, nitrogen dioxide, particulate matter, and ozone. And ozone is the pollution that increases, particularly during heat waves, because of, as you were saying, the chemical processes. So it's very good news to hear that the UN is taking action on this. And also there's news that the World Health Organization is putting in place training for health professionals to train them on the effects of air pollution to keep everybody safe.
In terms of images that have kind of got our attention in recent weeks and months, the wildfires have kind of been very much visual for us. Some scientists arguing that this is perhaps the most visible sign of air pollution. Is that a view that you share? Is that something that is kind of telling us just how urgent this problem is?
So we often think of things like heat waves and air pollution as invisible killers that are linked to climate change in some way. Wildfires definitely are a more visible form of air pollution that we can see, but we should consider them only one form of air pollution. And oftentimes, the ones that we can't see can be just as deadly as the smoke that we see from wildfires. What is actually really sad is that we don't know as much as we could about the effects of smoke on people's ongoing health, because if you think about it, exposure to a wildfire, it can be very difficult to track the impacts on the health of somebody throughout their lives unless we had good access to their continuing health records. So that's something that we need to take into account to be able to track this impact better.
I mean, it's interesting what you say, because a recent study by the Energy Policy Institute, the University of Chicago, really kind of underlines that industrial emissions are perhaps the biggest external threat to public health. It speaks about vehicles and also sand. Is that something that you'd agree with?
So dust storms in parts of Africa, you were talking about the African continent having that event pre-COP28. So dust storms has a massive impact on the health of people in Sahara, but also up into the Mediterranean part of Europe. So that is a major concern going forward. But also other industrial pollutants are important, as is indoor pollution. So where in countries they're not using clean indoor cooking fuels, this can have a massive impact on people's health and also increase their likelihood of death, actually, as a result of just not using clean cooking fuels because they don't have access to them.
I mean, you spoke there about this kind of landmark climate summit that has just wrapped up in Nairobi. How refreshing, how is it important is it to see, huge continents like this considering the clean energy transition? Is that heartening as a climate scientist?
It is really heartening. I think it's really important to see this unionisation of Africa and them strengthening their position pre-COP28. I think that as a continent, they are home to the fastest growing population on the earth, a really young population, and they also are on the forefront of climate change. And I think it's really important to see them going into this COP with a strong negotiating power. And I really hope that other nations listen to them and give them the funding that they need, because they've been calling for that that with other nations, such as island nations, for many years now. I think it's also important to see whether other countries have met their carbon emission reduction targets, and this is the first year that we'll be able to see that. So I'm really hopeful that this COP will be a success, despite the backdrop of it being in a country that is a leader in the oil industry.
Just a final question for you, Chloe. We're more aware than ever of, the need for global coordination when it comes to climate change action. On a personal note, you've spoken about industrial emissions and all of these pollutants that are affecting people's health. Is there anything you can do on a personal level to, make things healthier for you, the air around you, perhaps? How do you protect yourself from such bad air?
So one thing you can do is that if you're not using a clean cooking fuel, if you're in that position, is to use it. But also, if you were in an experience where there was a wildfire nearby causing smoke in your direction, you should close the windows of your house. But also, with COVID, if you wear that mask, it's been shown to have some protective benefits during wildfires from that smoke pollution. So there's two simple things that you could do.
Okay, well, thank you very much for that, Dr. Chloe Brimicombe. You're a climate scientist. Been great speaking to you today and having your expertise. Thank you, Chloe.